Okay, so one of the questions is, what about the medicines that you give us post-op, particularly what about the Pepto? Okay, and the answer is, remember that our biggest fear is that you'll have the surgery and have a problem, a complication from the surgery. And we don't like that, we're embarrassed about it, we feel bad about it. Our preference would be to have a perfect surgery, an ideal surgery, one that had no complications and no problems, and everybody just did wonderful. And we know that a lot of people do great from the surgery, a lot of people do well from the surgery, but not everyone. Okay, what are the risks and what are their frequency? The biggest risk that we worry about afterwards is an upset stomach, or what we call gastritis, or an actual ulcer. Okay, and Tums, Pepto-Bismol, yogurt, the Prilosec, all of those are antacids and help protect your stomach against an ulcer. But even if you don't take any of those things, most people won't get an ulcer. It's like wearing a seatbelt. If you wear a seatbelt, does it protect you from a car crash? Well, yeah, but most times when you're in the car, you're not in a car crash. So do you need to wear your seatbelt every time? We suggest you do, but if you didn't one time, it's probably not a big deal. In the same way, Pepto-Bismol is probably good because the bismuth, which is in Pepto-Bismol, helps kill the bad bacteria called H. pylori that can cause an ulcer. So we like it, but it's not absolutely critical because most people won't get in a car wreck. Most people don't have to wear their seatbelts. In general, though, I would take some Pepto-Bismol. Do you have to take it? No. If you get sick and you throw up and you hate it and life is terrible and you just can't stand Pepto-Bismol and you'd rather jump out a window than have it, maybe not. But in general, if you can, it's a good thing. Also, remember in the first weeks and months post-op that your medicines are not critical. Some medicines is good, but it's not absolutely critical.
Because I get the side effect of like black tongue.
Yeah. I'm not worried about the black tongue. I wouldn't worry about that. That's no big deal. But again, I wouldn't worry too much either. If you miss a dose, you say, boy, I have just had it. I feel awful. It doesn't feel good. I just skip it. And you guys have to catch a flight. Okay, staples out? Okay. Do you have your staple remover? Okay.
Did you say black?
Yeah, like you wake up with a black tongue. It's really weird. But it's the first time I woke up.
Bismuth.
Kind of like your little
You're also, not to get too graphic about things, but down below can turn black also.
Ooh, that's a thing to do with me.
Yeah, absolutely. You don't
We
have
want
to
to ask about that later.
but the bismuth turns everything black.
Oh, okay.
You're feeling great. I've got pretty close to
Bye, doctor.
Bye.
How are things in Beirut?
Oh, it's good.
No shooting?
whatever.
Who's running the show in Beirut? Who's running them?
Okay. Congratulations. Thank you very much. Yeah, you have to meet us in Paris.
Yeah.
Tell Mama. Right.
Well, thank you so much, doctor.
Bye-bye. Congratulations, and stay in touch. It's not out of the woods, so.
Bye.
Okay, and then we're also going to do our other post-op patients so they can take off. Mickey, you look like you're struggling.
Yeah, today I've had a rough morning.
Oh, can you tell us?
Just feeling overheated and just,
Tired?
yeah,
Weak?
all of the above.
Maybe not getting enough fluid?
I don't know, I drank quite a lot this morning, maybe too much this morning.
Oh, really? What did you drink?
I had a VA, had a couple